Postpartum depression, everything you need to know. After giving birth to her first child, Peace struggled to adjust to life as a new mom. She was exhausted from lack of sleep and overwhelmed with the constant demands of caring for a newborn. She found herself feeling irritable and short-tempered, and she had little energy or interest in the things that used to bring her joy. She wasn't bonding with her baby the way she thought she would, and she often felt guilty and overwhelmed. Peace's husband and family noticed the changes in her and encouraged her to seek help. After talking to her doctor, Peace was diagnosed with postpartum depression and started attending therapy and taking medication. With the help of her healthcare team and the support of her loved ones, Peace began to feel like herself again. She was able to bond with her baby and enjoy the special moments of motherhood. Peace learned that postpartum depression is a common and treatable condition, and she was grateful to have received the help she needed. Hello everyone and welcome back to my channel. For more weekly updates on pregnancy and related topics, don't forget to click subscribe. Postpartum depression is a type of depression that can occur after giving birth. It is a serious condition that can impact a woman's ability to care for herself and her child, and it can also affect her relationships with loved ones. While it is normal to experience some changes in mood and emotions after giving birth, postpartum depression is more severe and long-lasting. It is important to seek treatment if you are experiencing symptoms of postpartum depression. Symptoms of postpartum depression can include persistent feelings of sadness, hopelessness, and worthlessness, loss of interest in activities that used to bring pleasure, difficulty bonding with or caring for the baby, difficulty sleeping, even when the baby is sleeping, changes in appetite, either increased or decreased, fatigue and loss of energy, difficulty concentrating or making decisions, feelings of inadequacy or guilt, suicidal thoughts. Some of these symptoms are common for new mothers to experience, especially in the weeks right after giving birth. It's important to get treatment, though, if these symptoms last longer than 2 weeks or start to affect daily life. Postpartum depression can occur at any time during the first year after giving birth, although it most commonly develops within the first few weeks. A woman's likelihood of experiencing postpartum depression may be increased by a number of risk factors. These include a personal or family history of depression, a history of postpartum depression or other perinatal mood disorders, stressful life events such as financial problems or relationship difficulties, lack of social support, complications during pregnancy or delivery, a difficult or traumatic birth experience. It's important to remember that any woman, regardless of age, income level, or level of education, can experience postpartum depression. It is not a sign of weakness or a lack of maternal instinct. There are several treatment options available for postpartum depression. The most effective treatment is often a combination of therapy and medication. Therapy can help a woman understand and work through her feelings, and it can also provide her with the tools to manage her symptoms. Cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, are 2 types of therapy that have been found to be effective in treating postpartum depression. Medication can also be an effective treatment option for postpartum depression. Selective serotonin reuptake inhibitors, SSRIs, are a type of antidepressant that is commonly used to treat postpartum depression. SSRIs work by increasing the levels of serotonin, a chemical in the brain that helps regulate mood. It is crucial to go over the potential advantages and disadvantages of medication with a healthcare professional. If you think you might be suffering from postpartum depression, it's critical to get help as soon as you can. The more quickly treatment is initiated, the more likely it is that it will be successful. It is also important to remember that postpartum depression is a treatable condition. With the right treatment, most women are able to fully recover and enjoy their lives and relationships with their babies. It is also important for women to have a strong support system in place. This can include close friends, family members, and a medical expert who can provide both emotional and practical support. Support groups can also be a helpful resource for women with postpartum depression. These groups offer a secure and encouraging setting for women to talk about their experiences and get support from others who are facing comparable difficulties. Finally, it should be noted that postpartum depression is a serious condition that may affect a woman's capacity to take care of both her child and herself. It is important to seek help if you are experiencing symptoms of postpartum. Thank you for your time.